patient supine and the therapist standing on the opposite side of the involved leg. Take the hip to 90 degrees of flexion and mid-range external rotation. Using your fingers, palpate the lateral knee and lateral ankle and have the patient contract their piriformis by pushing against your fingers, doing so with only 10% of their strength. The patient should do this while inhaling at the same time and then relaxing while they exhale while the therapist takes the leg to a new range. Again, have the patient repeat by inhaling and pushing against your fingers 10%, and then exhaling and moving to a new. With the patient supine and the therapist standing on the opposite side of the involved leg, flex the hip to 90 degrees. Above 60 degrees, the piriformis acts as an internal rotator. Apply pressure through the femur with your chest to help keep the pelvis on the table, not allowing it to rotate when you stretch. Take up slack in the flexion, adduction, and external rotation. Ask the patient to then contract their piriformis by bringing their ankle outward and their knee outward. Hold for 7 seconds. Have the patient relax, and then take up more slack into flexion, adduction, external rotation towards the patient's opposite shoulder. This should be held for 14 seconds. With the patient in sideline and the involved leg up, place the pillow between the knees for comfort. Identify the PSIS and the greater troch and meet in the middle to locate the piriformis muscle. First, apply free up to the skin as well as to your fist and glide downward across the muscle to help improve flexibility as well as decrease tone. This should be done on the skin and could also be performed in the prone position. This should be repeated multiple times to improve flexibility and decrease tone.